Hello, everyone. I'm Robin Begley, CEO of the American Organization for Nursing Leadership and Senior Vice President of Workforce and the Chief Nursing Officer of the American Hospital Association. It's great to be with you here today. Welcome to the AONL Foundation's latest longitudinal nursing insight study release. Thank you so much for taking the time to join us today to learn about the current primary challenges identified by our members, nursing leaders. We intend this to be an interactive webinar, so please enter your questions into the chat. Joining me today to discuss the latest results of the AONL Foundation's four-part longitudinal study conducted in collaboration with Joslin Insight is AONL President Eric Martin, Vice President of Patient Care Services and Chief Nursing Officer at Norton Children's Hospital in Louisville, Kentucky, and Hunter Joslin, President of Joslin Insight. Welcome, Eric and Hunter. Eric, over.
I was on mute. How about that? The oldest trick in the book. I was just getting ready to say, thanks for having us. It's great to be here with you guys. I want to take a moment just to thank the nurse leaders who, despite the busyness that all of us have been experiencing, have taken time over the last couple of years to participate in our longitudinal study. This survey has provided us with incredible insight and has been extremely helpful in navigating the critical things that we need to address in nursing and in healthcare to forge a path forward. The results of this latest survey validate what I'm feeling. I think they'll validate what you guys are feeling as well. And it helps us feel that we're not alone, that there really is a community out there for us.
Agree with you, Eric. I just think there's such a common feeling of, we're in this together and we need to lead through and look to the future. So Hunter, on a national level, we've heard about the struggles that health leaders, in basically all settings, hospital, healthcare systems, other organizations, we're all continuing to face the challenges. Can you talk about the latest challenges facing nurse leaders and how these challenges may have changed since the last survey?
Yes, first, thank you, Robin and Eric, for having me on and for the AONL Foundation for making this research possible. And I want to echo Eric's thoughts and say thank you to all the nurse leaders who have provided their input over the last 2 years in the 2,300 and the most recent survey. If we look at the top 3 challenges, in the most recent survey, which was August 2022, we can see that emotional health and well-being of staff and staff retention are clearly the top issues. And this was similar to 1 year ago. And this is followed by travelers and contingent workforce, which was actually a new addition to this survey based on changes in the narrative in healthcare at the moment. If we look back all the way to July 2020, we know that access to PPE and other supplies has increased or improved dramatically. It was actually once the top challenge, and it now comes in under 1%. And communicating and implementing changing policies actually was once the second highest challenge, and it's now improved considerably. Over year, though, we have seen some worsening metrics when it comes to access to financial resources, as well as maintaining standards of care. And then when we look at the top 2, emotional health and well-being of staff and staff retention relative to each other, emotional health has actually improved slightly, but staff retention has worsened. And as we look ahead to intent to leave, this is clearly connected to retention. This is specifically, concerning nurse leaders and not staff. But when nurse leaders were asked whether they intend to leave in the next 6 months, you can see here in the chart that 13% said yes, that they plan to leave, and 25% said maybe, that they're considering leaving. This is about 38%, and notably 45% of nurse managers said that they either plan to leave or are considering leaving in the next 6 months.
Those are some somber statistics, Hunter, that you highlighted. I like to sometimes look at the glass half full and think that 25% that's maybe is 100% opportunity for us, right? And I think what your previous slide reiterates or affirms for me is that the focus that our AONL Workforce Committee has been looking at, which is solely strategies to support nurse leaders, is spot on. In fact, our first compendium that we're going to be releasing later next month focuses on talent acquisition and retention for nurse leaders. It will hopefully offer practical solutions that they can operationalize, whether they're leading a small team or a large system. And we hope that it will help provide some tools for nurse leaders to really navigate these challenging times.
Yeah, I'd also like to add, Eric, that and Hunter, that the focus that AONL has on our nurse managers, I mean, that's validated by, by the results of the intent to leave from the nurse manager group. So, we know how critically important they are to the operations and to, just to healthcare in general. Those frontline leaders, our nurse managers, really carry the water. So I think we are, we're definitely focusing on where we need to be keeping our eye on. So how about we dive a little more into burnout? And I know that's a word that we hear constantly. Nurse leaders identified low morale and burnout in last year's study as the biggest issue that they hadn't previously faced. So in other words, the last time we did the study a year ago, we were very surprised and concerned about seeing the number around our I guess it was self-report of emotional well-being. So Hunter, can you fast forward? We know we have our results now a year later. Fingers crossed that we're seeing a little improvement, but we'd love you to talk about that a little bit.
Yeah, gladly. We didn't ask the same question that we asked in the previous survey last year, because that was asking for new challenges, and burnout was emerging as a new challenge at that point. It was obviously a challenge earlier in the pandemic as well. Now it's been normalized, so we didn't ask that question, but we did ask, as we noted, retention is an issue, and we did identify burnout and exhaustion as one of the leading factors that's connected to retention. And we have the data for that. And as we look at actual retention over the past 6 months, as you can see in the chart that's here, it's 13% of nurse leaders who've changed their positions in the last 6 months, which is interestingly the same number that said yes, that they plan to leave. So again, with what Eric said, that means that 25% that's a maybe is actually, they're on the fence. And I think that they, organizations can find ways to reach them. But in terms of burnout and exhaustion, we know that this is one of the leading reasons for leaving. In this next slide. Yeah, so we see that this is at 26% of the respondents said that this was one of the reasons that they left in the past 6 months. And this is the third point. The top one is better work-life balance, which I think is critical. And then looking for new opportunities. But burnout and exhaustion, since we're focusing as well on managers here, which was a big turnout in this survey, it was actually 46% and tied with the top two choices.
This is great data, and I think it really helps us as nurse leaders know kind of where to focus our time and energy. The other thing that kind of resonates with me about this is we oftentimes are talking about the financial challenges that we're all facing and the pressures around that. But many of the things that we talk about on here can be addressed in a fiscally responsible or maybe with no real financial investment period, such as work-life balance. We are oftentimes hearing from leaders that flexible scheduling options, the ability to work, a day remotely, a pay period, or a couple of days a month would really benefit them. And that can be accomplished with little or no cost to an organization. The same thing about, addressing violence and bullying and incivility in the workplace, adopting a zero tolerance policy and addressing some of these bad behaviors doesn't cost the organization anything. If anything, it improves morale, increases retention and engagement from the workforce.
So Hunter, what about, the slide on the screen, solutions to improve individual satisfaction? I think that when you dove into the data, did you see any nuggets that you'd like to share with us around individual satisfaction? I mean, we do so much. I think we do, all of our members work so hard at the organizational level. Sometimes when we do a survey like this, we're able to identify, individual responses, and not by person, of course, but by their responses, and we may learn something new. Anything that you in your, I know you have done a very deep dive into this information that you've received. Anything that you would like to highlight?
Yeah, I think that this question, which we introduced in the previous survey last year, was starting to try to shift the narrative a little bit from just looking at the challenges and the issues and starting to look at solutions that could fix these challenges. And I know that I think there's a lot of appetite right now for a more positive narrative. And what we saw here was that to improve their work satisfaction, one of the number one response was to improve the staffing shortage. And this is clearly a quagmire. So people are exiting because of the staffing shortage. So this is a tough scenario for organizations. Increased salary and compensation, we see this in different research that we do. It always comes up. And then support my work-life balance. But that's the third one here. And I want to get back to what Eric was saying, because this is, I think, low-hanging fruit, because this is an area that organizations can address that's maybe at a low cost, even free, and it can change the way that organizations are operating and what they're focusing on. And most interestingly, when we look at actual turnover, staffing challenges and increased salary or pay are actually really low in terms of their correlation to actual turnover. But as we saw in the previous slide, support my work-life balance is near the top. So again, I think that this is an area that should start receiving more attention, and it'll change the narrative in general about how we're approaching healthcare and our workforce.
One of the questions, I realize that today's webinar is more just a little teaser for our members to kind of get an idea of what this year's results showed. But one of the questions that I most appreciated this year was the add-on around how nurse leaders are spending their time. The question really tries to quantify percentage-wise where leaders are spending their time. And then you ask the same question in terms of what frustrates them, what areas most frustrate them, and which areas most bring them joy. And it's fascinating to see the delta between where they spend their time and where they want to spend their time. And it resonated with me, and it made me think, if we can find ways for nurse leaders to spend more time doing the things that bring them joy and less time doing the things that frustrate them, we might be able to capitalize on that 25% that are maybe thinking about leaving their position. And that might be how we, get them to stay and retain that talent.
Yeah, that's a great point, Eric. We all became nurses and nurse leaders, to make a difference, but it's really about that connection to purpose. And, when we think about the administrative tasks and the operational tasks that we do during the day, I mean, that's, and I think the, the information certainly supports this, that's not what fills our cup. So, when we think about well-being, and when we think about, being able to go home even after a challenging, difficult day, but feeling like you spent a good portion of your day doing what really matters. I think that can make all the difference. no one ever dreamt that nursing was an easy profession, so I don't think that's the expectation that our nurses and nurse leaders have, but we really do want to, find joy in what we spend our day and our lives really, engaged in. So this has really been great. And, to your point, Eric, about the slide or about the information and the question we were asked about, how do you spend your day? What gives you joy? I mean, and I see a couple, I'm following along in the chat. The entire report will be available on our website following this webinar. We're taping the webinar, but we also will have the full report up on the website. So this again is just a teaser. It's full of great information. And those of you that took the survey, I'm sure you're aware that there's just so many great questions here, and I'm sure you'll be interested in the responses. So I just want to thank Eric and Hunter. We'll now take questions. I'm actually looking at the chat. Let's see. We have a comment from Robin Silber: being authentic with our nurse managers and truly caring about them, showing that they are valued. Absolutely. We know recognition and meaningful recognition is absolutely positively correlated with, intent to stay and also, to well-being. So that's a great comment. And we're open for any questions you may have. So if you have any, please feel free to put them in the chat. Eric, you look like you're going to say something.
I was going to say, not to make a shameless plug, but I'm going to make a shameless plug for the foundation has done a lot of work around the Beyond Gratitude campaign to help recognize nurse managers for the challenges that they've faced over the last couple of years. And I think there's some really good nuggets on that website for leaders to tap into to help recognition in their areas as well.
Yeah, great point. So do we have any data on what specific action items could be implemented around work-life balance? I think part of, just to set the stage here, the work that this study informs is our AONL workforce initiative. We have 7 groups working on actionable items, on best practices, on innovations from around the country that our nurse leaders have supplied. So Eric mentioned our compendium, which the first phase will be out in November. And that's where we will, we have one group working on positive practice environment. And in particular, we will see practices in that section. But I think it's safe to say that really when we look at all of the 7 topics or the concepts, each of them contribute to positive work-life balance. So more to come there. The questions are rolling in. So can we speak more to workplace violence? So I know, some of our questions, it was new that as Hunter reflected, this survey, we saw the emergence, if you will, of workplace violence as a really big issue. Eric and I also participate on the AHA Hospitals Against Violence Committee. And we, there's a toolkit that is available and a framework. So, we know that incidences of violence across our country are elevated. I guess, we would be surprised if we didn't see it in our healthcare organizations, which is very upsetting. This, though, as I travel the country and speak to different groups, is really popping as an issue that nurse leaders and nurses and other healthcare workers too, for sure, are really being verbal about. And I think, there are many challenges. Some of the challenges relate to there's no common definition of what constitutes workplace violence incidents. So there's work that's happening there, and it really does. And the Surgeon General commented on this in his report, that it really is a spectrum. It is from incivility and it's verbal violence, and incivility, as well as, of course, the other end of the spectrum, which is, horrible things like mass shootings. So another word that I'd like to mention too, another plug, this month, the AONL and ENA, Emergency Nurses Associations, document our guiding principles that we had actually initially put together. I believe it was 2016, if I'm not mistaken. Anyway, we have both organizations have collaborated on the new guiding principles, the refreshed and revised, if you will, and they will be announced actually October, I believe, 28th, around that time frame, and they will be on. There'll be a joint blog post from AONL and from ENA, and they'll be publicized and available on our website. Eric, I know you participate on our and are heavily involved in the Hospital Against Violence initiative. Anything you want to add there?
I would just add that I think this year we are bringing on new members to that workforce committee, looking at some broader initiatives around diversity and belonging. You mentioned mass shootings. We've had some really good rich dialogue around gun violence and preparedness for issues like that, and the measurements for success. So how will we know that we're making an improvement? And I think our last call, we had some good discussion around what are some baseline common metrics that hospitals across the nation can start gathering and submitting data on, so that we can know where to focus our time and energy and know that we're making an improvement over time.
Yeah, Hunter, anything you want to speak to from the the workplace violence perspective?
Yeah, I actually just pulled up some statistics here. For those who are interested, I saw that question had come in, and we asked nurse leaders whether or not they have witnessed one or more incidents of either workplace violence or bullying or incivility. For bullying and incivility, 72% of nurse leaders said that they had witnessed this in the past year. And when it comes to workplace violence, it's 53%, and for CNOs actually 72%, which is really high. Again, I think this requires unpacking to understand what these definitions are and what people are actually reporting or consider to be either workplace violence or bullying or incivility. But on the website, we also show the data around this, so you can see not only the extent of bullying and incivility and workplace violence, but also the source of the act. So, where it's coming from and what people are seeing.
Thank you. That'll be really interesting information for people to dive into. And I think that, I mentioned the guiding principles from ENA and AONL, but, complementary to that is a toolkit. So really excited about partnering with ENA. And we will, we'll make sure we properly announce, these new tools and information when they get released. Could we add the link to the chat? We're going to be putting that all on our website, the information following this webinar, correct? Stacy, I know you're helping us out in the background here.
I was about to put that in the chat. Yes. So following the webinar, AONL, the website is actually live, but we will send an email to all members with the link to the website and this recording.
Okay, great. Thank you. So any other questions or comments in the chat before we wrap up?
I would just add, kind of tag along with what you were mentioning earlier about our workforce committee. The results of this work and our mesh study on workforce are all of that data and information is being shared with the members of our workforce committee. And Robin highlighted that that group has it's grown tentacles, if you will, and we have 7 subcommittees that are working on different focus areas. And just to highlight what those are: talent acquisition, retention, leadership, positive practice environments, total rewards and compensation, academic practice partnerships, and culture of inquiry. So those are the 7 areas, and we're teasing out all of the data that's appropriate for those areas and the comments that we've gotten through our live or mesh survey, and really making some informed, timely, relevant decisions and offering some real life examples and case scenarios of ways that nurse leaders have been able to move the mark in their organizations and really make some improvements.
So Hunter, any last word before we close?
Yeah, on that point, we did have one other data point that's really interesting, and that has to do with solutions that leaders are implementing to address the workforce shortage that are actually having a positive impact on work environment. And that's also going to be on the website, and that should be useful information, I think, for other leaders.
Okay, that's a great teaser. So we'll end with that. I would like to thank Eric and Hunter for joining me today to discuss the findings of the AONL Foundation's Longitudinal Nursing Leadership Insight Study. It was the 4th. The full study is available right now within 2 minutes at aonl.org, and I really highly encourage you to review it, as we only scratch the surface. There's really great information. And to all of our nurse leaders, thank you for your leadership during this incredibly difficult time. We are working with AHA, with the larger nursing and healthcare community, with policymakers, with industry partners, to address the challenges that you have identified in the survey. Thank you so much for sharing your insights, and have a great day.